Now, Anneliese joins me from the Health Hub Times Square in Ballincollig. Good afternoon to you, Anneliese.
Good afternoon, Patricia.
And I know it's a chilly day, but it's one of those gorgeous winter days, isn't it? With the low sun in the sky.
Absolutely beautiful. And the sun comes in our front window there. So it's just so warm on your back, it's heaven.
Yeah, it's great.
It's lovely.
It really is great. Okay, straight into questions. Hi, a question for Anneliese, please. What would you recommend for somebody who had shingles? I've still got a bit of nerve pain and there's also a bit of the rash still on the skin. It's 4 weeks since I was diagnosed. Can shingles last that long? It can.
Oh, yes, Patricia. And gosh, some people actually get residual nerve damage from shingles that can go on for years afterwards. So it can be really painful. Those nerves can become hypersensitized and flare up, and it's very painful to wear clothes or anything over it, you know. So in terms of this person, what I would suggest is that they take something like a tonic in order to get a good boost and just get the energies back up and get the antiviral stuff going on. And then in terms of the nerve damage, now there's a couple of things that could help. There was a great homeopathic remedy called Hypericum, Hypericum. Unfortunately, our homeopathic remedies have been disappearing off our shelves in the last year, and we can no longer get it. But there are a couple of dispensaries around the country. I think up in Dublin there's the Hop Fac, or you could go to a homeopath. And that's definitely worth trying. You can also get Hypericum as a cream. Now, Hypericum, a lot of people would know it as St. John's wort. Most people would think about it for depression.
Yeah.
And unfortunately, it's on prescription in Ireland only. But you could, like Dr. Clare does a St. John's wort oil that is topical. You can't take it, but you can put it on. So that could be a way of getting it if you can't get in touch with a homeopath for the homeopathic cream or the homeopathic remedy. So it's spelled Hypericum, Hypericum, and the Dr. Dealish Clare does it as an oil. We do have it here in stock. The healing cream that she does as well is actually lovely. There's some St. John's wort or Hypericum in that as well. So either of those, if you can get your hands on those. And then Lion's Mane is a supplement that you can take for nerve damage. It's great for people who suffer from nerve damage from diabetes, from injury, and also it's good for the inflammation of nerves from shingles pain. So you'll get that in a powder or in capsules. It's a medicinal mushroom. It is absolutely wonderful. I'm taking it at the moment actually for memory, so I'll let people know how that goes in terms of that. So Lion's Mane, take it internally, and then the Hypericum or the St. John's wort as a cream, and if you can get the homeopathic remedy, take that as well.
Okay, and best of luck with your recovery. Now, morning, this came in bright and early this morning. Morning, Patricia, question for Anneliese, please. I'm a 72-year-old female with high cholesterol. The cholesterol reading is 6.4, LDL is 4.2. Now, I've started taking the following: plant steroids, fish oils, vitamin D, B vitamins, magnesium, and I've got 3 questions for Anneliese. Dosage, please, on all of those supplements. Should I take vitamin K? And is there a comprehensive supplement brand that would have all of these vitamins included in one? Many thanks. I'm trying to avoid a statin and I'm trying to stay healthy in West Cork.
Yeah. Well, there's an awful lot going on there now, truthfully, and there's a lot of supplements been taken. So my recommendation would be to call into your health shop or to call in here with a list of your supplements. And you can always bring in your blood results. A lot of people can read those. We read them quite a lot for our regular customers here. The ones that would be very specific for cholesterol there are the plant sterols and the fish oils. So the plant sterols can bring your cholesterol down by about 17%, and the fish oils can help raise your good cholesterol, which is the one that helps, take away the old cholesterol from your arteries and veins and gets rid of it out of the body. So that can increase that, and if your HDL is good, generally you can be healthy. To be honest, the best thing for high cholesterol is the red rice yeast extract. It does work in the same way as the statin, so it is like taking a statin, but it's a natural remedy. So it's got other things in there besides just what they've isolated to put in the statin drug. And we would find that a lot of people who haven't been able to tolerate the statin because of the side effects of muscle pain or short-term memory loss, etc., have no problem tolerating this, and it is very effective. So I think if your goal is to bring your cholesterol down, that's the one you should be focusing on. Vitamin D and vitamin K are very good to take together because vitamin D does increase your absorption of calcium, and if you have too much calcium and cholesterol in your arteries, the calcium will harden the arteries, and that's what forms the plaque. So taking a vitamin K is protective of that. It can help it get into the bone, the calcium get into the bones where it needs to be, rather than to harden the plaque in the arteries. But I would be very careful of taking a calcium supplement if you're worried, if you're not taking a statin drug, if your cholesterol is elevated. For that reason, I think it could increase your risk of heart disease for that reason.
Okay, so be careful.
Yeah.
Okay. Now, hi, Anneliese. I've been diagnosed with degenerative inflammatory arthritis. It's in all my joints, extremely painful. I'm on weekly methotrexate. What type of arthritis do you think this is, and what supplements would you recommend?
I don't know, Patricia, what kind of arthritis it is. So, everything that happens in the body is inflammation. And all aches and pains, that is inflammation. Degenerative means, and arthritis means that there is inflammation in the joints that is causing degeneration. Now, it depends on what is driving that. Sometimes it's wear and tear. Sometimes it's an autoimmune disease like rheumatoid arthritis. There's psoriatic arthritis. These all tend to have autoimmune components. Because this lady is on methotrexate, I'm thinking that the doctors haven't been able to pin it down to specifically either rheumatoid arthritis or psoriatic arthritis, but do think that there's an autoimmune component because of the methotrexate. But this is me just presuming now, really. So look, in terms of general degenerative arthritis, taking stuff to support the joints is very important, and the natural route is to put in things that support the cartilage in the joints, such as glucosamine, MSM, sulfur, collagen. They're all really good for joint support. The UC2 cartilage is particularly good, especially if there's possibly an autoimmune component. And then to take a natural anti-inflammatory such as boswellia or turmeric. When it comes to autoimmune disease, I think there's an added complication there because it's the immune system causing the damage as opposed to general old age, wear and tear, inflammation from using your joints too much. And with autoimmune disease, I find there's often a link with the gut. So I would recommend this person goes to see a proper practitioner to see where are the drivers here if there is an autoimmune component. What is going wrong that the immune system is hyper sensitized and attacking the joints, and work at that level. But for everybody else who is suffering from degenerative arthritis, all of the things I mentioned are really good. And the best feedback we get are on two supplements. One of them is called GAL, UC2 cartilage, and the other one is One Nutrition Joint Factor. So you could go and try those from your local health shop and see if you get a benefit.
Okay, a listener has what she describes as an itch up her nose, but is sneezing a lot with it. What could be causing that?
Sounds like an allergy to me.
Yeah.
So itchy nose, runny nose tends to be an allergy. This time of the year, if it's flaring now, it can often be damp, it can be a mould sensitivity or a mould allergy. Very, very common, Patricia. I see it all the time with people that have kind of post-nasal drip or recurrent sinus infections. It's actually driven by a mould allergy. And last year it was horrendous for people who had that because it nearly rained every day of the year last year. So there was a huge amount of damp and mould. I think probably the best thing to do would be to try a nasal spray that has an antihistamine in it to begin with. Now, these long-term are not good. They tend to be steroids, and you can get a rebound effect from using them too much, which make your original problem worse. But it is good to try as an experiment because if it works, it means that it possibly is an allergy. If you can identify the allergy, fantastic. If it is mould, an air purifier really, or moving to a dry climate in Spain is the only answer. But you could try another couple of things as well. So Dr. Claire, she does the natural route for antihistamines is Dr. Claire does an Allertone blend, which have got natural antihistamine herbs in there. Some people find that NAC, NAC, is fantastic for anything kind of nasal drippy and chesty. So you could try a combination of the two of those. And there are natural nasal sprays that are very, very soothing. For example, the Otazan one has aloe vera in there, which is lovely if your nose is itchy as well. But there is another one called X-Clear, if you can get your hands on it. It's been hard to get these days, but that one also we get fantastic feedback on it. So a natural nasal spray could work there as well.
And can it, if it's something that's only come on this year, can you suddenly develop an allergy like that?
Yes, it's unusual, but just definitely, Patricia, you can suddenly develop, or it can worsen at times. You know, the gut has a huge part to play in terms of helping us manage our allergies. Sometimes what happens is that maybe a cough or a cold or some kind of a sinus infection might kickstart inflammation, and then it's much easier to irritate it by maybe something that might have been such a mild allergy before. So, like gut health, viral infections of the nose and respiratory, that'll all increase your likelihood of developing, more irritated allergies. A lot of women would notice as well that their allergies get a lot worse after menopause. So there's all sorts of things that can actually increase your chances of getting an allergy as you get older.
Okay, all right, we leave it there, Anneliese. Thank you for that. Have a lovely week, and we'll chat next Monday. Thanks a million. That is Anneliese Dressel, the Health Hub, Times Square in Ballincollig, and all of the items that we've mentioned today on Anneliese's slot she'll put up on her website this afternoon, which is healthhubstore.com.